Thank you, Presiding Officer. To ask the Scottish Government how it can support Sudanese community living in Scotland in light of the ongoing humanitarian crisis in Sudan.
Cabinet Secretary Angus Robertson.
Thank you, Presiding Officer. The Scottish Government stands with the international community and communities across Scotland in our shared deep concern over the violence in Sudan. This particularly impacts the Sudanese community living in Scotland, many of whom have friends and relatives who are directly affected. On the 10th of May, I met with representatives of the Sudanese community in Scotland, alongside representatives from the National Health Service and third sector support organisations. And this was a starting point for dialogue about how we can support the Sudanese community in Scotland, including ensuring Sudanese nationals living here are aware of support services that they can access and, where necessary, raising issues with the UK Government.
Claire Adamson.
I thank the Cabinet Secretary for his answer, and I would be very helpful if some of those signposting bits of information could be shared with colleagues, as this is obviously an ongoing situation. In my role as committee convener, I met with Sudanese health workers online from across the UK, and these vary from senior staff, senior consultants, through nurses to support services in our NHS, each a vital cog in making our NHS work. Some of their colleagues who work for the NHS were in Sudan at the time that the crisis arose. Others have gone back to bring friends and family to safety, particularly elderly parents and children, but they find themselves now in Egypt and Dubai, unable to obtain family visas. Can the Cabinet Secretary ensure that he is making these representations to the Home Office about the situation, as these are vital workers in our communities?
Cabinet Secretary.
Well, can I say firstly, I think Claire Adamson's absolutely right to highlight the role of Sudanese nationals and people of Sudanese descent working in our National Health Service. It's very important to understand quite how many there are, and they deserve our recognition and our support. And secondly, in terms of signposting information which individual MSPs may wish to share with Sudanese nationals and constituents, I undertake to share that information with her and other MSPs. As asylum and immigration, however, is reserved, this is a matter which we've been pressing the UK Government on, and I've written to the Foreign Secretary, and the Cabinet Secretary for Social Justice has written to the Home Secretary to call for safe and legal routes and arrangements for family reunion to be put in place. These must be flexible enough to enable people forced to leave Sudan to safely come to the UK and join family who already have leave to remain here.